Hello everyone, welcome to Talk Here with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Last week, 10th October 2022, was commemorated around the world as Mental Health Day, the World Mental Health Day. The World Health Organization defined health as the complete state of physical, mental, and psychological well-being. So in other words, if the mental health is not okay, that means someone is not healthy. It's very important and one of the most neglected aspects of the health sector. So just last weekend, a number of non-governmental organizations met in Abuja, took a walk, National Mental Health Walk, to create awareness and also draw attention of the National Assembly to ensure that the National Mental Health Bill it gets passed and also given to President Muhammadu Buhari for assent. So on the program today, we're going to bring you some interviews we had with participants in that walk, and let's get to know what Nigerians think about mental health and what they want the government to do about it. Also, on the second segment, we are starting the Health Agenda 2023. Is a segment on this show that we hope to continue till the 2023 elections. Because of the importance of health, most times during election seasons, they don't get adequate attention, they don't get talked about. No much agenda is being discussed. We keep hearing free maternal health, free this, just talked about in the passing. Of course, Talk Health Niger and Dark Communications PLC is very much committed and using the platform to ensure that, we put health as a topical issue and also as something that both Nigerians and the government is going to take very much more seriously. So from today, in the second segment, we'll be having our first set of guests who will be the All Progressives Grand Alliance candidates for governorship in Ebonyi State, both the candidate and the deputy governorship candidate. They will be sharing their agenda with Nigerians, and of course it's open to the electorate to listen and engage them further and also perhaps make their decisions. Do stay with us. After this break, we will hear what Nigerians who participated at the Mental Health Day walk had to say. We'll be right back.
Health Agenda 2023. The Nigerian health system is becoming weaker with the mass exodus of medical doctors, nurses, and other skilled health workers out of the country. In February and March 2023, Nigerians will go to the polls to elect the next president and state governors, respectively. This provides an opportunity for the election of leaders who will help to strengthen the health sector and reposition it to deliver quality healthcare services at all levels. We present to you Health Agenda 2023, an interview segment on this program for presidential and governorship candidates to discuss their health agenda before the electorates. For sponsorship and participation, reach out through any of the contact details displayed on your screen.
We are basically trying to raise awareness on mental health issues, mental health topics, and just facilitate collaborative discussions where we can push for the passing into law of the Nigerian National Mental Health Bill 2020, which is currently awaiting assent on the president's desk. And so we are trying to do advocacy for that, and we're also trying to just inform people about mental health, talk about mental illnesses and disorders, and just make it a normal conversation that we as Nigerians can have.
But it's only today that I went to the program like this, like mental. I didn't hear anything about it before. It's only today. But when I came here, I'm very, very happy because I see many things here. People don't see here. When you person living with disability, if you are in our very house, we used to think many things. We think as if we are nothing in the world. But when we come to the program today, the way I attend this program, the way I attend this program today, I feel it. I'm very, very happy today. In fact, I saw people here dancing when they are singing. I even join them at times. If I notice, I'm happy. In fact, I'm very happy. Please, this program is good. Please, they should continue this. And if they want to do their program, they should couldn't lose people living with disability. Because the way we sit at home, we just feel as this, they didn't care with us. They didn't even bother to worry about us, our health, what is bothering us. Nobody cares to us of us. Please, if something is going on like this, they should encourage us, please. And I know government are there. Government are there. They're not about us. They know we are there. Please, they should come and join hands with them, because I saw many people there. Please, they should come and join with them. They should come and join hands with them, please. Because we used to sit at home doing nothing. At times, we used to go beg. And this begging that we are going to, we doesn't want it. But we don't know how to do. That is why at times we used to go beg. They should come and check on us. They should know what they are going to do for us. Like, if you have something to do it, we used to come out or going to market and sell something. We don't go sit down in one place again and thinking of different things now. They should come and help us on that.
Nigeria is a very diverse society that makes up of people from different ethnic backgrounds, and our social situation is so peculiar that it is actually diverse. You know, it has a lot of socio-economic issues as well as cultural issues that actually affect us. So the issue of mental health in Nigeria is something that it's still coming up. We hope that one day we'll be able to take this awareness and the campaign towards people taking their mental health very, very seriously. If you look at the theme for this year's Mental Health Day celebration, is making mental health a priority, a good global priority. Okay, that is to say that mental health issues are issues that should be recognized and identified among people. If we don't look at it carefully, our mental health is related to our security, it's related to our spending, it's related to about how we live, how we behave, sports and everything. It is important, therefore, that all global leaders, communities and countries should make mental health a global priority for all of us.
I've had depression, different bouts of depression for years, right from when I was a little girl, before I even knew that depression existed and all of that. So yeah, the support system that helped me overcome this was actually my family. So it's more like it started because of my family, and then my family still helped me out of it. And then one thing with depression is that you never really get over it. So as long as it's there and you do not get like clinical treatment for it, it keeps coming back. Any small thing can just trigger it and it will start again. So one thing is, I know that I have my family to lean on. So whenever this thing comes up, I'm always like, see, and you know, they know how to help me, how to talk me out of it, the things I have to change, stop thinking too much and all of that.
Mental health is important because it's one thing that affects everybody. I don't think there's anybody out there that doesn't have a mental health issue. Like, you go through life is just stress. So you're definitely going to encounter something. If you don't induce the stress yourself, someone is going to induce it for you. So one way or the other, it's something that's always going to be there. It's just a way to manage it, and a lot of people don't know about it. So that's why it's important, sensitization, telling people that you have a problem that you live with. That it's not a death sentence or something, but you have to actually know that you have a problem, and you have to find out a way to keep living with it, and keep being yourself and keep getting happier day by day.
Depression is real. Mental health is something that should be generally addressed, and it baffles me when these people's voices are not heard. People don't even know, and the stigma around mental health. You see somebody that is mentally deranged, you feel they're crazy, you want to run away from them. I mean, these are the people that deserves your love, that deserves your care. So that is why I'm here, to work and to create awareness around mental health.
The first solution to mental health will come from a place of relativity. The fact that people know you and people can relate to what you're going through. That's family, friends, before any institution can come into play.
We communicate with people, we move around. For we to have a very good communication and relationship with people, we should be mentally good, sound, health-wise. That's what I think.
why we're here today is for the mental health awareness walk, and the walk is to push. We're trying to create awareness around the mental health bill that we're trying to pass. The bill has gone through 2 readings now. We're just waiting for it to be signed, pushed to the presidency to be signed. So part of what we want to do is to create awareness and to try and force a bit of the government's hands to see that like the Nigerians are really passionate about this conversation, and now is the right time for us to get this bill signed. So that's pretty much what this conversation is about. The issue of things like drug use and substance abuse comes from a place of an inability to express yourself or looking for outlets. So part of what we promote is just healthier outlets, like things like sports, things like dance, like what you're seeing behind us, yoga. Because at the end of the day, it's like, if you think about it, no one really wants to be addicted to drugs, right? Like no one enjoys being there. And like when you listen to some of all these people that are in that kind of space, you realize they're struggling with a lot of inability to express themselves. So part of what we're trying to do is to create opportunities for them to express themselves, be it things like spoken word, we do things like open mics, we do things around sports.
So you heard them out there, Nigerians sharing their thoughts on the need, for more attention to be paid towards mental health. By next week, I will be talking with the convener or the founder of Nigerian Mental Health, Mr. Chime Asonye. He is going to provide more insight on the components of the mental health bill that is before the National Assembly. So we'll move to the next segment, Health Agenda 2023. Do stay with us. Yes, in Nigeria, 2023 is a very significant year. It's an election year. A lot of issues are going to be discussed, and of course, campaigns started on 28 September 2022 for the presidential elections, as well as the National Assembly elections, which is holding in February 2023. Also within the month of October, the governorship and state assembly election campaigns is going to officially start. A lot of issues from security, from economy, and all of that, are topping the charts. But of course, with COVID-19 pandemic and a lot of, monkeypox and other diseases of public health importance still ravaging the global health space. And of course, Nigeria with its weak health system and the brain drain in the health sector also makes health a key topic and a key consideration for this election season. So on the program, we are going to be talking with a number of governorship candidates and of course, the presidential candidates at some point to discuss their health agenda. Health Agenda 2023, this is the maiden segment. I'll be hosting the governorship candidates and his deputy from Ebonyi State, Southeast Nigeria, on the platform of All Progressives Grand Alliance, APGA, or also called ABGA. They'll be discussing what their health agenda is for Ebonyi people should they win the election in March 2023. I know you can't wait to get to hear from them. Of course, one of them is a health expert who has been on this program before, and the other is a professor of geophysics with deep knowledge in development and governance. You are going to enjoy this program. Do stay with us. You're going to see them after this break.
Health Agenda 2023. The Nigerian health system is becoming weaker with the mass exodus of medical doctors, nurses, and other skilled health workers out of the country. In February and March 2023, Nigerians will go to the polls to elect the next president and state governors, respectively. This provides an opportunity for the election of leaders who will help to strengthen the health sector and reposition it to deliver quality healthcare services at all levels. We present to you Health Agenda 2023, an interview segment on this program for presidential and governorship candidates to discuss their health agenda before the electorates. For sponsorship and participation, reach out through any of the contact details displayed on your screen.
Welcome back to Health Agenda 2023 on Talking Health with Dr. Lars. As you can see, I'm already seated with the governorship candidate of All Progressives Grand Alliance in Ebonyi State, Southeast Nigeria, Professor Bernard Ifeanyi Odo, you're welcome to the program.
Thank you, Dr. Lance, for having us in your show. The pleasure is ours.
Thanks, Your Excellency. Professor Odo, of course, as his title suggests, is a professor of geophysics at the Nnamdi Azikiwe University in Southeast Nigeria. He was also a secretary to the government of Ebonyi State from 2015 to 2018, and is a consultant to several local and international organizations. And of course, seated next to him is the first guest we had on this show, a health economist, a public health expert, Dr. Nkatawani Chukwu. You're welcome, sir.
Thank you very much, Dr. Lance, for having us on the show.
Yes, Dr. Nkatachukwu is the running mate, or of course, the deputy governorship candidate of All Progressives Grand Alliance, ABGA, in Ebonyi State, Nigeria. And in the next 20 minutes or thereabouts, we'll be talking the health agenda they have for the people of Ebonyi State. Prof, Ebonyi State health indices, is not looking very good. You have less than 10 medical doctors in employment. You have one pharmacist in the employment of the government of Ebonyi State. Nurses, medical laboratory scientists, every cadre of healthcare workers are highly inadequate. The infrastructure, yes, in terms of buildings, the general hospitals are looking good from the outside, but largely empty on the inside. The tertiary hospital is the one that belongs to the federal government. A lot of people in the Ebonyi State, to have serious intervention in their health sector or meeting their health needs, have to travel to Abakaliki from every point in the state. So looking at this, what do you intend to do if you win the March 2023 governorship election?
Okay, so once again, like I said at the beginning, we're delighted to be on this show. First of all, our understanding of governance is that the greatest asset of any society are society citizens. If we don't get our people prepared to become assets, then they will keep dying as liability the way they are doing today. So in Ebonyi, for today, the numbers you gave we are kind with the numbers. We actually have 6 medical doctors in a population of about 3.5 million people. The nurses are 17 in number, pharmacists just 1, no medical lab scientists as of today. We don't have medical rehab personnel, so we don't have medical record keepers, we don't have, name them. So the first thing we intend to do differently is, first of all, to ramp up a process that expands the human capacity involvement in the health sectors. The numbers today are grossly inadequate. Our people die on a daily basis because you have people traveling 2 hours to get to where we have the tertiary healthcare facility. This tertiary healthcare facility is already overstretched because, again, they have their own issues. It's funded by the federal government. They have space challenge, they have manpower crisis, they have all kinds of issues. So we need to get our primary healthcare facilities working quickly to avert the situation we find ourselves now. Our projection is that in our first 4 years, we should be able to recruit additional 50 health workers.
50 health workers or doctors or addition?
At least 50 doctors, but we intend to expand the entire workforce of the health sector, but at least 50 doctors in the first 4 years.
Okay.
These are our projections. If we do this, the implication is that every local government will have a minimum of 3 doctors to go around the primary health care facilities. We also intend to strengthen our partnership with donor agencies. What we have in Ebonyi today is that most of the partners that intervene in the health areas are not happy with the way the health sector has been abandoned. We don't have data now for many of our primary health care facilities. Without data, you can't get support. The intervention that can be tracked because you don't know whether there is performance based on what has been invested. So we want to build and solidify those collaborations and make our performance accountable and transparent so that more people can put in resources. 2, we may not be able to get all the people we require to get, but at the rural communities, we can train people that are lower the ladder
Okay.
To participate in providing the basic health knowledges that are required at the rural communities. We have 171 wards across the state. These 171 wards, people who have basic training in schools, WAEC, can be deployed to provide basic health support. And now we'll have a center that can provide virtual support to those facilities from remote sources. So we intend to approach this differently. We don't want to leave our people to continue to die the way they're dying. Investment in hard infrastructure, they are good, but they're not as good as investment in soft component, the human person.
Right.
If we have qualified people working in health centers, they will be able to avert much of the crisis that we faced. In the last 7 years now, almost annually, we have outbreak of Lassa fever in the brain. And these are all things that can be averted if we have the right kind of personnel, the right kind of both training, the right kind of hygiene, the right kind of information that should be available at the rural communities. So these are the basic things we think we will approach differently. Our budgetary provision also must be in line with what is globally acceptable.
Right.
We want to benchmark our budget on the SDG goals. Global awareness is part of what we should and must be able to, hinge all our programs on. We don't want to run governance that is not anchored on anything. We want to run all our budgetary processes to anchor on SDG goals, so we can measure progress and now check whether the goals we set for ourselves, whether we are meeting those goals or whether we need to do some re-evaluation of our strategy and approach. So these are some of the key things we tend to do. And I'm also happy that I have someone who is vastly experienced in this area.
Right.
In terms of assessing global fund, in terms of providing the technical skill requirement to deal with these issues. So Ebonyi is lucky that we have, the kind of human critical resources that we need to drive a governance process that will reduce the current challenge we have in the health sector. This is, in a nutshell, what we intend to do differently when we emerge next year.
Thank you very much, Prof. I'll get to the health experts on the ticket. In fact, if he were to be in the university system, he'd probably also be a professor. So you mentioned some key things that struck. One is you said secondary school leavers, could be recruited to provide some kind of support within the health space, especially at the primary health care level of volunteers. Which kind of roles will such people be playing?
For instance, record keeping. Nobody has any health record now. Birth record and death record. We don't have record. Nobody knows how many people are born daily in Ebonyi.
Okay.
There is no such record now. We don't know how many people die daily in Ebonyi. So we cannot make a forecast. We cannot make projections.
Right.
In terms of population projection, how do you budget for people based on population that is emerging on a daily basis? So health record is one critical component that we think we can train people with basic education to understand what to do.
Okay.
Also health information on hygiene, basic hygiene, basic what is it called again?
Health education.
Health education, basic health education, health promotion, sensitization, and all of that can be done by, you don't need high-tech people to provide those kind of services.
Right.
So anyone who has a background in science from secondary school, physics, chemistry, biology, mathematics, can basically fit into this lower level knowledge dissemination at the rural level. And it also creates opportunity for young people to participate in governance at that level. And now they feel sense of being part of the governance process.
Okay.
So that's the kind of thing we are envisaging to do with our young people. Even community leaders, teachers in primary schools in the rural communities can all get involved. The more people who can integrate into this ecosystem, the better result we can get from dealing with our health crisis at the rural level.
Right, sounds good. Finally, before we take a break, you talked about the budget, the benchmark, and using SDG as a key benchmark. So, what proportion of the health budgets do you intend to allocate to health? The Abuja Declaration of 2001 recommended 15%. Are you going to use that as a benchmark, or do you have something different?
Yes, absolutely. It's important that we take health. Like if you go, I don't know if you have read our documents for our first 4 and 8 years. Our agenda is simple acronym, B shapes.
Right.
The B there stands for business environment. The S there stands for security. The H there is the health, which is what we're discussing now.
Yes.
Now, our cardinal focus in governance will be health of our people, education of our people, and now feeding. All of this done in an environment where people live in safety and decent environment. So the 15% is a minimum threshold, especially with the intervention fund that will come from different places. We're going to run open governance processes. People can access us and see what we're doing. So 15% for us is a modest budgetary provision for the health sector. It could be better than that as we progress, but that for us is a minimum benchmark.
Thank you for being with us. You've heard Professor Ifeanyi Odo and also Dr. Nkatachukwu, the candidates from Ebonyi State. So next week, we are going to take the second part of that interview. Of course, the deputy governorship candidate will be speaking more during that second part. Thank you for being with us. We're still open to other candidates who want to discuss their health agenda to come on the show. My name is Dr. Laz Eze. Same station, same time next week. We'll still be talking health. Bye for now.